The COVID-19 public health emergency is ending in the U.S. after 3 years. More than 1 million Americans lost their lives during the pandemic. Now coronavirus deaths and hospitalizations sit at their lowest point since March 2020. The end of the national emergency means your Medicaid health coverage may be at risk as states resume eligibility checks. You could also have to pay for at-home COVID tests, so check with your health insurance first. The good news, vaccines are still free. So what's next for long COVID patients with the national emergency ending?
Alex Littlehales explains state and federal health officials are still only at the beginning of figuring out how to help.
Things still aren't quite the same for Maddie Smith.
Those weeks turned into months. So I started to feel like maybe something wasn't quite right.
So Maddie Smith's journey in trying to find care for her long COVID-19 symptoms is not a unique one for many other Americans in her position. Here's how her story goes. About 9 months after her initial COVID-19 infection, she went to the emergency room after she said she was experiencing shortness of breath. She says she didn't feel medical staff there took her condition seriously. And months after that is when she went to an endocrinologist, where she was then diagnosed with Hashimoto's disease, which is an autoimmune disorder that impacts someone's thyroid.
Dormant and underlying. And then when I had the active COVID infection, that kind of woke everything up.
Smith shared her story during a University of Virginia long COVID briefing Thursday, joined by Virginia Congressman Don Beyer and Senator Tim Kaine. Smith's challenge in finding proper care shows the new pivot by federal agencies to figure out what these patients need. For example, getting to the bottom of why research from the National Institute of Health shows Black and Hispanic populations are more likely to have symptoms of long COVID compared to white populations. I'm Alex Littlehales for 13 News Now.
This change will not impact access to COVID-19 vaccines and treatments like Paxlovid.